Hello, everyone. Welcome to the seminar Talk with the Expert, episode 3. Today, we're discussing about a very crucial topic for all athletes. TUI, I use a prohibited substance, but what should I do? The seminar is a result of a partnership between three international federations, World Ability Sports, IBSA, and Virtus. I'm Juliana Soares, anti-doping officer, and it's my honor to have moderating this dialogue today. I would like to introduce our two guests today. First, sorry, Mohy, because I'm not really good in your surname. Let's see if I can make right.
It's okay.
Mohy
It's okay.
Eldin El Gahaf. Right?
Right. Okay.
Thanks,
So
Mohy.
yes.
Sorry. So he's our chairman from the TWAC. So he had been studied a lot of about sports, medicine, and drugs. He had his post graduation in drug sports from IOC. So congratulations, Mohy. Also, we have our wheelchair fencing world championship, Anri Sakurai. Thanks, Anri, for coming here. So let's start. Um, as we know, doping is a challenge in sport, affect not only our integrity of competition, but also our health and the health of all the athletes, okay? This seminar aims to guide athletes to the necessary steps if they need to take any medicine, any prohibited substance. We are honored to have here Dr. Mohy, who is specialized in sports medicine and a professional fancy athlete who can share the experience and insights. Thanks, guys. I will start today with our doctor, Dr. Mohy. Okay. First, Mohy, can you explain to us how a TWAC, TUI is it except sorry, Therapeutic Use Exemption Committee, and works, and your duty as a chairman, but also the team that you have. Could you explain better how TWAC works?
Okay. Thank you, Juliana. Hello, everyone, and thank you for this opportunity and for your invitation. It's my pleasure. Well, as you all know, from 1999, from WADA established, it's published its anti-doping regulations. One of these regulations is the prohibited list, which first published in 2004. And in briefly, the prohibited list, which is groups of medications and substance which are prohibited and not allowed for any athletes to be used except in a legitimate medical conditions, in a specific conditions for limited times and under limited medical conditions. For that, WADA published an international standards called International Standards for Therapeutic Use Exceptions, which are the criteria and the standards allowed for any athletes suffers from medical conditions, legitimate medical conditions, and needing to use one of the prohibited substance to be used after specific investigation and specific criteria in researched and uh, uh, each or anti-doping organization and each international federations have its a specific committee called TUE committee, Therapeutic Use Exception Committee. This committee is formed from a group of medical experts, sports medicine physicians, and of sports pharmacists, and another types of specialized in the medical fields like for respiratory, GIT, hormonal. Our rules or main rules is to research and investigate each case by case, individual case by case for any athletes suffer from any medical condition to apply the criteria specified in the international standards of therapeutic exceptions determined by the WADA. The goal is to save the team sport, to save the rights of the athletes whom suffer from medical condition, and to protect any athletes from illegal athletes whom may try to cheat or to use the prohibited substance in a wrong way. Our team and me as a chairman for the team take the all the time to search the details for each case by case to be confirmed that the athletes really need this treatment, need this medications without any cheating, without go out from the standards of the WADA, and to save the competition clear and safe.
Oh, thanks, Mohy. Let's see if we understand correctly. You are the two chairmen, so you and your team, made by doctors, pharmacists, physicians, biologists, you receive this information. And regarding the WADA list or prohibited list that WADA publish every year, you
Yeah,
individually check and analyze case by case to
sure.
see if the athlete has the health condition or the needs to use that prohibited substance. And
Right.
one by one, it's not the same decision for everyone. You are going to grant her or not the TUI for this athlete, right?
Yes, sure. Yes,
Ah,
exactly.
so amazing. Thanks, Mohi, for explaining to us how works the TUI. Now, I would like to ask our athlete, Anri, Anri, for your professional athlete perspective, I would like to
Yep.
understand better our experience regarding TUI. Have you had any TUI or you know anyone that requests a therapeutic use exception for the World Ability to Act team, like the Mohi team?
Yes, yeah. Hello, everyone. Thank you for inviting me. So the issue of prohibited substance use, which is the theme of today's session, is something that constantly surrounds an athlete career. For athlete in particular, I think we may face this reality even more directly than Olympic athlete. And I have two different experience with TV applications. The first time I had to apply for retroactive TUE because in the third year of my athletic career, I suddenly developed a serious spinal cord infection that required emergency surgery at the university hospital. And during that surgery, certain medication were administered that happened to be on the prohibited list. But it was an emergency, so there was no time to apply in advance. I had to go through the retroactive application process. And at that time, I was still relatively new athlete to sports, so I didn't have enough knowledge of anti-doping rules. But suddenly being told that I needed to apply for a TUE came as a huge shock, and I remember feeling extremely anxious. And on top of that, the surgery ended up lasting 12 hours. And while I was already worried about my health condition and my recovery, the added pressure of how this might affect my athletic career made it incredibly stressful experience. However, fortunately, the nurse who looked after me post-surgery was a former Japanese international athlete as an Olympic team. So she kindly and clearly explained about the TUE process to me, thanks to her support, and which close communication between my doctors and her. I was able to collect the necessary medical information and gradually ease my anxiety. That allowed me to focus on my body recovery. The second time application of TUE was more general pre-application, advanced application process. And WADA has announced that medication I had been using for a long time as a part of my treatment was to be newly classified as a prohibited substance. And this was a relatively recent development. And since I'm based in UK rather than my home country, not in Japan, so I need to coordinate everything with my primary Japanese doctor remotely. And to complicate matter, my primary doctor had recently changed, and my new doctor wasn't familiar with the TUE process. So I worked together with a sports pharmacist and doctors of Team Japan to prepare the required document for my TUE application. And I think in clinical situation, even at the large scale university hospital, it's quite rare case for a doctor to have a patient who is a top level international athlete and requires a TUE. And that's why I strongly encourage all athletes and their support team to understand this process well in advance and start preparing as soon as possible. Yeah, that's it.
Anri, you gave so many highlights important here that it's even hard to summarize. But for sure, the way that you close, it's maybe the most important. It's not just the athlete duty to know how to process a TUI, but the coach, the medical team, even the administrators. It's really good to know how works the TUI request because they can support the athletes. Like in your situation that you live in two different countries, very different countries, because they are not just far away from each other, but the language is also different. The way that the prescribed medicines are very different. It's very important for all the athlete support personnel to understand how to request a TUI. You have two different situations. Emergency one, that is a retroactivity for sure. Your health is the most important for us, but also you have one that you had time to collect information and send in timetable application. So thanks for explaining how stressful is this process, and who is watching this even recorded, please go to our website and check how to request it to. If you're taking a substance, check if the substance is prohibited, and if it's prohibited, how the step by step how to create a TUI. It's very important, guys, as he explained here. Thanks, Anri. Mohi, I know that you and your team received dozens, many TUIs requests per year from Virtus, from Wordability, from IBSA. For example, the Anri TUI request was analyzed for our team and when you need it. So could you give to us like some tips how the athletes must to apply a TUI and what they need to pay attention, like what's the exact documentation they need to send to us to have a TUI granted by the International Federation?
Well, first of all, the very important point I should confirm it is that the healthy and the medical condition of the athlete is the first in the priority in the anti-doping field and anti-doping world. So, as Sukari said, any athlete may suffer from emergency case. So please, we direct start the treatment, and after that, start the retroactive TE. And as the secretary said, that the TE is a obligatory process applied by WADA for each athlete. Unfortunately, many TE applications we receive are incomplete or lack necessary medical documentation, which delays the decisions process or even leads to rejection. So let me share some key points for athletes and their medical teams to make a strong and a complete TUE request. First of all, athletes and his or her physicians should understand well the TUE and the prohibited list. Firstly, before using any medications, the athletes must confirm if the substance or method is prohibited. Many athletes, unfortunately, apply for a TE too late because they don't check the list early. And also, if athletes suffer from chronic condition like asthma, diabetes, don't wait until the start of competition. Please apply the TE early as possible to avoid last minute stress. Second point, which is provide a complete medical documentation. As we in the TE committee apply a specific criteria and which needed a complete medical documentation, as we often receive applications with missing medical records. So please, to approve any TE, we need a clear evidence of diagnosis. This include detailed medical history and clinical notes, details diagnosis documents, details lab test and lab results like spirometry for asthma, MRI or CT scan for injuries. And also a letter from a specialized physicians to support this documentations, not just a general practitioner. It should report from a specified medical physicians for the specified conditions. Also, the third point should be cleared that athletes and his physicians should show that there is no alternatives or no permitted alternatives for this prohibited substance, as what criteria require that the prohibited substance is the only option to treat the athlete's conditions if there is no unpermitted alternatives. So athletes must demonstrate that non-prohibited treatments were tried or considered, and they were no effective for his case. And to be honest and transparent, never try to hide the other medications or treatments, please, you are taking. Any lack of transparency can raise questions and delay the process from the TA committee. And my last advice is apply with enough time. Don't wait until a few days before the competition. Some cases require additional questions, additional documentations for clarifications, and rushing may result in rejection simply due to lack of time. And Again, for emergency cases, we can evaluate retrospectively TEE, but this is not ideal and often come with additional circumstances. In summary, I advise all athletes work closely with well-knowing physicians about the prohibited list and anti-doping regulations. Submit a complete and well-documented medical field. Finally, plan early, double check the prohibited list, and always ask for guidance for unsure any data.
Thanks. Just an information, guys. As we start a little bit early, waiting for the connection, maybe the link can fall. So please, if for some reason shut down the seminar here, just click on the link again, right, Moshi?
Yes,
just click again. Without Moshi, what we do. So, Moshi, you have some questions, please.
Yes, I had one very important question, which I think many of the people might have. Mohi, you already touched upon it slightly, but I think it'll be nice if you can elaborate. It's about the timeline. So, how early they need to submit? Because I understand that there is a lot of documentation they need to put together, and you also need a lot of time to process it, right? So, how long does it take for you to receive an application and for you to make the decision, like the full process? How long is it?
Okay, according to the international standard for TE, they mentioned that or advised that before the competition from 21 days, it advised athletes to apply the TE. But practically, and as we faced in many cases, it may take a month or more investigation, and we request many documentation. The athletes should return to his physicians and prepare the documentations to and stamp it, or have to make more diagnosis. So my advice, if you athletes have a chronic conditions or have a well knowing conditions, start your application, start your preparation before the competition 30 days, or if you can more than, as you know that in specific time you should and you have and you are obligatory to apply TE. So why not to take your time and prepare your documentation and take and save the time to sure to apply a proper TE request.
Yes.
One thing that it's just to complete Mohy, what Mohy explained. Our TUI Therapeutic Exception Committee has 21 days to analyze.
Mm.
You should apply in advance. But remember, if you forgot something, like Mo explained, we are going to have 21 more days as soon as you send again the paper that
Yeah.
you're missing. So it's not 21 days and everything is done. No, no. We have 21 days as soon as all the documentation came to us.
Yeah.
For example, the Ritalin that we have many athletes from Virtus, for example, using Ritalin. What's the document you must just send to us? The TUI form, the medical report explaining the situation and how many drugs he or she tried to prescribe to the athlete before. And also, it's not exam, and usually it's a test explaining why the athlete is on THE, autism, or any diagnosis. So these three. So imagine you send the medical report and the test, but the form is with a handwrite letter that it's impossible to understand. It's not filled the right way. They forgot the signature of the athlete, the coach, the parent, the doctor. So we are going to send back to you. And the time going to restart. So Moshi, really good your question, because explain to the athletes that as soon as you have the prescription, the request sent to us, doesn't matter if the competition is next month or in 6 months, send it to us, because our team, Mohi's team, is going to work and give the granted to as soon as possible to you too. So good question and a good explanation, Mohi. It's important for them to understand that it's not in 5 minutes.
Yeah, it's interesting to know that 21-day cycle restarts if someone is sending an additional document, because some people might just send it and then they will start asking question. No, but we have 21 days.
Yeah,
It's we already sent you on time.
Yeah.
So
when we
yeah.
have the papers to analyze. If you're missing documentation, how it's simple. For example, if you're on the street, I broke my leg, and the doctor says he broke the legs, but where's the X-ray? What's the MRI? Or I don't know, depends of the proving that it has happened. Because unfortunately, like Mohi explained in the beginning, we are working to protect the clean athletes. Unfortunately, we have athletes that are not playing clean, so they can try to make some tricks with us. I'm trying to take the best words for this. So we need to have the proof. So Mohi's team, we need to have all the informations from this athlete, from this endurance, to analyze and give the appropriate data also. For example, for Ritalin, we need to use for many years, but maybe for a twist ankle, we can give just some weeks the medicine. Did you understand different? So Mohi needs to understand how much how long this TUI is going to be granted to also. So we need to understand deeply the diagnosis of the athlete. So if Juliana, that is going to be me, that going to reply the mail, say, please, I need more information. And I explain usually, like, you need the report, you need the form. Please take an account and review everything that you did. It's 21 days as soon as we have everything in our hands.
And there's just a point that many
Please.
athletes thought that just apply for TUE and present the document, it's approval for the TUE. No, it's just a start of the process. As there are very many details, very many background criteria as we have to apply according to the WADA international standards to have the guarantee of the TUE. So please, the application and the apply of the TUE form is just a start of the process, not the agreement of the TUE.
Yeah. When we finish the process, if you receive a grant or deny, it's going by email, this information. So if you don't receive an email, it's still ongoing. Okay.
Yeah.
And if for any reason you didn't receive an email, you said, weird, 21 days passed and nothing, send again an email like, hi, Juliana, what's the issue with my TUI? Because sometimes go to a spam box or any situation that it's a misunderstanding. Please, you need a TUI granted form from Adams. Okay, guys, from Adams that I send in copy. Moshi?
Did you have any cases where someone must have sent you the all the documents and it's maybe like 21 days or 30 days, I don't know, but you might be missing some documents and as you said the email is in the spam or somewhere for whatsoever reason didn't get sent, but the athlete reaches the competition and he or she is competing. Did you ever face this situation with any athlete?
And the athlete had been tested or not?
Yeah, yeah, and the athlete is getting tested, and it's a complicated situation. So, do you allow like the athlete to compete, or what if the athlete has competed and then they are getting tested and ends up in a controversial situation?
You wanna answer or me, Mohi?
Not from you. It's an anti-doping issue, not TUE
Okay,
issue.
okay. We never had any positive test indeed for this in Virtus. But why am I putting the Virtus an example now? Ritalin, it's a prohibited substance in competition. But for sure, no one can take and stop. Take and stop. It's a continuum medication. Like Mohi explained, if you have a chronic need, like Ritalin, Vinvance, I don't know other name,
ADHD.
any substance like this that it's a stimulant and you need to take even in competition, we deeply suggest you to request it to it. Don't stop the treatment between competitions because it's dangerous for you, athlete. It's the same for other substances for example, tramadol also. It's a very complicated issue for wordability, for example. We have so many wheelchairs or amputees with pains that they must to use tramadol. So please. But as Moshi explained, we don't know if the athletes continue or not. So this is why we test the athletes. But sometimes I'm pretty sure that we have some athletes in Virtus that don't have TUI and still taking Ritalin. However, many of them has a very good excuse. When the Anri explained about the retroactive TUI, we have some explanations why we should request a retroactive TUI. In Anri's case, was she went to the hospital for surgery, so it's a health condition with no time to request. But sometimes we have a gap between international athletes and national athletes. What's international athletes, for example, for world ability? It's if they go to world ability games or world championship. If the athlete just compete in the fencing cup, for example, he's not considering an international athlete for requesting a TUI. He's a national athlete. Unfortunately, not all the countries treat international athletes for all sports. Virtus has a lot of this. So sometimes the athlete, they said, look, if you are not going to the Paralympic Games, for me, you are not a national athlete. So imagine how many athletes we have around the world that is not international and not national. So if you want this gap, you can request retroactivity to it. So the majority of the athletes that are taking a substance that is prohibited and doesn't have a TUI, so we don't catch them, it's because they are in this gap. The majority of them for Virtus, Word Ability, and IBSA, because they are, how can I say, um, I don't know the name of this. Oh, maybe you, Mosh, that it's English speaker. It's really a gap. So we are not international or national, but we never caught anyone. We caught once one athlete that was doing a treatment, but the request of the TUI had already started. And the TUI was not in time enough. They sent this athlete sent before less than 21 days, but the process was ongoing already. So we could finalize the situation. But remember, you should start to take the medicine just after Mohy's team granted a TUI.
Granted.
Okay, wait.
Yeah.
Because this guy had luck.
And this I always asked about that any athletes, please be aware. When we granted any TUE for any substance, we grant it with a specific concentration for a specific time. So, any athletes try to misuse or overuse the concentration, the WADA lab will detect the over concentrations and will consider it anti-doping rule violations. So please, any athletes, don't try to misuse the TUE grants.
I don't. This has happened a lot, with more often. Uh, we have, for example, for blind ones, we have an eye drop that is the Urzulamida or Brizolamida. If you use as eye drop, it's not a prohibited. But some athletes sometimes use as a tablet. Yeah. And the lab tells us this is a tablet.
Yeah.
So the athlete can try to explain, oh, what's a eye drop? I said, but you drink 1 liter of eye drop? So yeah. So don't try to cheat, because we have numbers at the lab that proves that is not the substance that you're telling. So good.
One more question. So
Go ahead.
it's a very interesting topic, and I'm sure like many people will relate to this question. So what if the situation is a genuine situation? Like for example, an athlete is competing at the competition and they get injured. And as you said, there are some medicines which are used by physically impaired athletes for as a pain reliever or something, and they have to take more than the dosage which is suggested. So what do you do in these type of cases? Like it's a genuine case. The athlete gets injured and they have to take the medicine more than what is recommended, or maybe something which is not even asked in the TUI, something which is banned, but they have to take for their injury within the competition. What do you do then?
Okay, medically, each substance have the maximum dose for the therapeutic use. Okay, so usually in the TUE committee, we make approval for the limit of the therapeutic use. So any physicians will knowing and will practice medically, I don't think that he will try to use more than the therapeutic use, because we have two terms: therapeutic dose and prohibit or and performance enhancing dose. So
Mm.
any therapeutic dose should be in the limit of the accepted and in the limit of the TE approval.
Okay.
So
Right.
no conditions that medical conditions may need this, except if this emergency conditions, and this
Yes.
always will be
Yes.
treated in the clinical or not in the court.
Maybe I can draft it with my hands. Imagine the athlete needs, all the athletes are here. And
Mhm.
our athlete that needs the medication, it's here. He is going to take the medication until be the equally all athletes, not better. Did you understand? So we are going to balance the competition. People that with some disease that need support going to be competing at the same level. One thing that it's important that's going to create a link of both explanation. Who prescribed the medication in competition for this athlete?
Mhm.
If the medical doctor of the athlete that had already requested the TUI, or the medical doctor at the competition, like the doctor at close to the swimming pool that doesn't know
Mhm.
the history of the athlete. This
Mhm.
is something. Imagine Anri is there playing, and for some reason, I don't know, the straps of the chair broke up and she fell to the chair and she hurt her shoulder. Just an example. She has already medication, and just to give an example, for pain on her ankle. This doctor must understand that she's already taken medication and that this is it's for health condition that must take care not to overdose the medicine and maybe be unhealthy for her. So when you're athlete, explain it. Look, I take a medicine already. It's going to conflict with this new medicine that you are prescribing, or I know that I cannot take more than 20 milligrams per day because I have a TUI. Are going to prescribe it one more pill for 21 milligrams? If I'm going to the test, it's going to be positive for sure because it's going to be the double size of the. So it's very important for the athlete to understand that he or she it's 100% of the what's it's found in her or she or his body. Okay, so you athlete must explain to the doctor close to the swimming pool, close to the fencing, close to the judo competition that you're already taking the medicine for pain, for asthma, for THE, doesn't matter. And you cannot conflict with the medicine and the two you have. This is the I explained.
Yeah, yeah. While you were explaining, I know that like for athletes with visual or physical impairment, it's like they kind of know and remember what medicines they are supposed to use or not use. But in terms of athletes with intellectual impairment, they tend to forget, right? So in that cases, who is responsible if they end up in controversial situation? Who is responsible? Who
Legally,
do you?
unfortunately, legally, on the government side, can be the father, the parents, but in sport environment is the athlete. Yeah, we know that we are facing sometimes some challenge with our legal department, but the athlete is responsible. So we know that sometimes looks like that's not fair.
Mhm.
We understand the situation, but the same way that we teach our athletes to be the best as possible in a swimming pool, running, or jumping, or dancing,
Yeah.
judo, we need to teach them to protect themselves. And one of the teaching tools is don't take anything before talk with your coach. Don't take anything before talk with your parents because this is can protect them for any advertising. Oh, I hate this word. In advertising case, I hate this word.
Okay.
Uh,
I mean, this is a completely different topic, but maybe this is another area where they might need extra support, the
uh,
II athletes. Like you allow someone like a chaperone to help them in the testing area, to guide them, to explain how they can do it. Uh,
mm,
Maybe
we
it's
are going
another
to
area.
we are going to have the final the I think the same I think is in November about tests, but just to give a summarizing about this, II athletes during the doping control process are treating like a minor, so it's mandatory to have someone inside the doping control station with the athlete. So this way we can avoid any questionable situation.
Yeah. So maybe I don't know, it's a completely different topic, as I said, but it could be something we can talk to Wada and see like how in these type of situation the athlete, because of the impairment, they might not remember all the names and everything. So I think it could be a bit unfair for them to end up in the legal consequences. I know, of course, like if they are doing something illegal, they will be accountable and they will be sidetracked or like banned. But if it was like if someone else
So,
also needs to be there to support them.
but
That's it.
sometimes even us, we don't know exactly the medicine that we are taking.
Yeah,
The white box with a red sign. We don't remember. So this it's understandable, and our legal advisor is already one of the persons trying to lead this conversation. And for sure, something that happens because once we had a positive case in Brazil that is we are going to talk in another meeting, but this II athlete had a positive case for a very simple medication in Brazil. The athlete had received the sanction, but for sure, his sanction was not so hard as a sanction for a no II, because we understand that his mother gave the medication like it's just a normal pill that I buy, for a lack of information. And the athlete's impairment also, it's harder to understand everything. It's hard to understand for everyone.
exactly.
It's not just for them. It's every day I learn something. Mohy teach me something about drugs every day. I call him like, Mohy, we have, I don't know, 12 insulins. Dear God, how? And he teach me. Or an athlete, Juliana, it's so hard to understand this way. So it's in II athletes and learn every day, and also us. So it's like, I think Brian wants to. Thanks, Brian, for coming here. Um, sorry. Usually it's like 20 minutes, and we are here 1 hour, but it's amazing. I love it. Brian, please.
Hello, how are you?
Hello.
Uh,
Would you
Hello.
like to make some question?
Yes. So my name is Brian from Kenya.
Wow.
Yes, that is part of East Africa. So I work with the national team, the Kenya national team, the team doctor.
Mm-hmm.
I'm the founder of Immediate Care Sports Clinic. So my question is, at times we get athletes getting in medical help from our facility, but they don't mention that the athletes, we do a prescription. So when they go for the competition, they're told that they're doping. How do you handle this in your country as compared to our country?
Sorry, I think I didn't understand your question. The athletes
I'm
taking
saying
the prescription at the venue with no information.
they don't mention the athletes. They don't say they're actively involved in these sporting activities. So you go
Oh,
on to do your
let's see if I understand. They prescribe, but they don't know if this person is an athlete or a normal person. This is your question.
yes, yes.
Okay. This is a part of our team education process. So one of the part of the TUI process is to check if the substance is prohibited or not. But the only person that can tell to the athlete if it's prohibited or not is the doctor. So athlete's duty is to tell, look, doctor, thanks, but I'm an athlete. I'm going to pass through anti-doping tests. So could you please check if it's prohibited or not? If your doctor, because it's very common, deny to to check if it's prohibited or not, please send an email to us, to International Federation, and we are going to support you, because we know that sometimes it's the doctor is not very keen
Conversant
on
with the
to help every athlete to understand if they're prohibited or not. But please send to us if you have a question. I deeply suggest you use a global draw, that is an app. So what's going to happen is, Juliana, this substance is prohibited. I'm going to teach you how to research the substance. So use the global draw, and don't miss the information. Don't take the medication before to make sure that it's prohibited or not, because sometimes even me, if I don't double check the medication. Sometimes I send to Mohy, look, Mohy, I'm new to it, and he just said, this is not prohibited, Juliana. Oops, sorry. So we need to check.
okay, fine.
Thanks for the question. Just to finalize, I have one question for Anri, that she's here. Um, Anri, do you believe these tips that we are here for 1 hour talking make the life of the athlete easier? And do you have other tip, because you are an athlete, you pass through requested to it? Do you have any like super tip to give to our friends?
Yes, so I truly believe that these advice we hear today has been incredibly helpful, and including myself, many athletes who do not use English as their first language need to be extra caution when submitting these applications. So especially with their medical team, that's why I strongly feel from my experience that the most important aspect of a TUE application is to prepare and submit it as soon as possible. They can make things much more complicated. And what a website and the National Anti-Doping Agency provide details, information that is always accessible. But however, to be honest, the information can sometimes feel a bit too formal, too difficult, and too technical for athletes. It's not always easy to digest, especially when you are under stress. So I believe the session like this, where we hear real stories right directly from athletes and from pharmacists, from doctor, such a valuable resource, and they help make the whole process feel more accessible and relatable. And also one small but important tip: make sure to save a copy of your TUE certificate, either as a screenshot on your phone or as a printed version that you keep with you because it needed during the doping test. And once again, when it comes to renewing your TUE, action is key. So if there is one message I like you to remember from everything I've said today, it's this: just as soon as possible. So please don't forget this word for athlete. And this is golden rule when it comes to TUEs. Following that principle will give you peace of my mind and follow you to stay focused on your training and performance. And that's it. Yeah, thank you very much.
Again, you always provide the best highlights. I want to take the expiring day as the most important for our watchers now. Please pay attention the day that expire your TUI, and don't try to request a renewal of your TUI on the day that expire. You should request in advance, okay? So if your TUI expire 1st of July, you are going to send to us 1st of June, 1st of May, because we have time to go and back that 21 days that we discussed before, to save everything and avoid any window between the TUI that you had for the one that you are going to have. Okay, because sometimes they test between these two TUIs, and I saw motion. I saw someone to be tested between in this window between the TUIs and tested positive and passed for a hearing panel. Amazing. Poor the athlete. But uh, what we can do, this is the athlete knew about. But yeah, thanks, Anri. Again, Brian, would you like to make some questions, or was just you forgot to put your hands up?
That was the other time. I asked my question already.
Okay. Let me reopen this. Again, guys, it's usually I have time to open the questions, but we did already. Thank you so much for your time. This video is going to be recorded on our YouTube channel. So please, if you want to share this video with your friends, please go there. It's on the YouTube channel for Virtus, IBSA World Ability Games. Okay. And our next meeting will be in 26th of August. Okay, I hope to see all of you there. It's going to be with our Dr. Marcelo Patricio. He is going to explain about the health regarding the use to prohibit medicines. It's, I think, one of the most interesting topics this year. So please, thank you so much, Brian, for being here. Mohy, thanks, Mohy, for your time. And to be fair, was the longest seminar we had this year. Usually it's just 20 minutes, but was amazing. Anri, thank you so much. I hope to see you in Korea next month to see you or playing. It would be a pleasure to know you in person. And Moshi, as usually, thank you so much for your support and your incredible work with us. It would be impossible to deliver this seminar without you. The Rio of Champions played clean. Bye.
Bye.
Bye, 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 bye.
Thank you. Bye.
Tá filmando.